My sister Tasha stood in front of our entire family at Thanksgiving dinner and said the words that would haunt me for months: Kate's just a glorified nurse. It's not like she's a real doctor. I bit my tongue. I smiled. I let it go. But 3 weeks later, when I was elbow-deep in a 4-star general's chest cavity in the middle of a military hospital during a massive disaster, performing emergency surgery that only a handful of people in the world could do, I realized something. My sister had absolutely no idea what she was talking about. And when General Franklin Benjamin himself took my blood-soaked hand afterward and kissed it with tears in his eyes, calling me the angel who brought him back from death, everything changed. This is that story. Before we dive in, let me just say, if you've ever been underestimated by someone who should have believed in you, this story is for you. But here's the thing, 97% of you watching right now aren't subscribed. And I get it, you're busy, you forget. But it genuinely helps me keep telling these stories when you hit that subscribe button. It takes 2 seconds. If this story resonates with you even a little bit, just consider it. Okay, now let me take you back to where this all began. Let me set the scene. Thanksgiving 2023. My parents' house in Alexandria, Virginia. The whole family's there: Mom, Dad, my sister Tasha, her husband Patrick, my brother Charles, his wife Elena, and my grandmother Bonnie, who at 84 still runs the entire family like a tight ship. I'm a nurse practitioner. Specifically, I'm a critical care nurse practitioner with an acute care certification, which means I work in the ICU at Walter Reed National Military Medical Center. I've spent 12 years in nursing, 4 years getting my BSN, 3 years working critical care, then back to school for my master's, then my DNP, then specialized certifications in trauma and acute care. But to my sister Tasha, who's a pharmaceutical sales rep, I'm just a nurse. The conversation started innocently enough. My grandmother Bonnie was asking me about work, and I was telling her about a complex case I'd managed, a soldier who'd come in with multi-organ failure after an IED blast overseas, and how we'd managed to stabilize him through this intricate combination of medications and interventions. I was mid-sentence when Tasha cut me off. "Mom, can you pass the sweet potatoes?" she said, not even looking at me. "I think we've heard enough about nurse stuff." The table got quiet. My mom, Paula, shot her a look. "Tasha, your sister was speaking." Tasha shrugged. "I'm just saying, we get it. You take vitals and give medications. It's fine, but it's not exactly rocket science." My brother Charles actually gasped. "Tasha, what the hell?" "What?" She looked around like she was the victim. "I'm not being mean. I'm just being realistic. Kate does important work, I'm not saying she doesn't, but at the end of the day, she's a glorified nurse. She's not a surgeon. She's not a doctor making the real decisions. She's following orders, checking boxes, doing the grunt work." I felt my face get hot. Patrick, her husband, looked deeply uncomfortable and suddenly became very interested in his green beans. "Actually," I said, keeping my voice steady, "nurse practitioners have prescriptive authority. I diagnose. I create treatment plans. I perform procedures. In many states, we have full practice authority." Tasha waved her hand dismissively. "Yeah, but you're not a real doctor, Kate. You didn't go to medical school. There's a difference, and I don't know why you can't just accept that." My grandmother Bonnie slammed her fork down. "Natasha Marie, that is enough. I'm just being honest, Grandma. Everyone here is thinking it, I'm just saying it out loud. My friend's husband is a cardiac surgeon at Johns Hopkins, that's impressive. That's something to brag about. But Kate gets defensive whenever anyone points out that nursing is just different." I stood up. "Excuse me. I need some air." I walked outside onto the porch, my hands shaking. Elena followed me out 5 minutes later with a glass of wine. "She's always been jealous of you," Elena said quietly. "You know that, right?" "It doesn't feel like jealousy. It feels like she genuinely thinks I'm beneath her." Because you chose a path that actually helps people instead of pushing pills for pharmaceutical companies? Yeah, that tracks. I smiled despite myself. Elena had always been in my corner. The worst part is, I said, staring out at the dark street, she has no idea what I actually do. She thinks I'm changing bedpans and taking blood pressure. She doesn't know about the emergency intubations, the chest compressions, the families I have to tell that their loved one didn't make it. She doesn't know that I've literally held someone's heart in my hands during a code blue while we waited for the surgeon to arrive. Elena squeezed my shoulder. You don't need to prove anything to her, Kate. But here's the thing. Part of me wanted to. Part of me wanted her to see, just once, what my job actually entailed. I didn't know I'd get that chance 3 weeks later. December 15th, 2023. 2:47 p.m. I was in the ICU at Walter Reed, managing 6 critical patients with my colleague, Henry, another critical care NP. It was a relatively normal day, if you can call managing ventilators, titrating vasopressors, and monitoring hemodynamic instability normal. Then the alarms started. Not our unit alarms. The hospital-wide disaster protocol alarms. Within seconds, my charge nurse, David, came running into the unit. Multi-vehicle collision on the highway. Military convoy involved. Possible VIP casualties. All hands on deck, and they're calling in everyone from trauma to critical care to assist in the ED and ORs. My stomach dropped. Multi-vehicle collision with military involvement meant this was bad. How many casualties? I asked, already moving. Initial report says 15 to 20, with at least 8 critical. The hospital transformed into controlled chaos. Within minutes, the emergency department was flooded. I was reassigned to Trauma Bay 3, working directly with the trauma surgery team. The first patient who came through my bay was a young private named Erickson, maybe 22 years old, with a massive abdominal injury and a pneumothorax. I was inserting a chest tube while simultaneously calling out orders for blood products when I heard someone shout from the bay next to mine. We need another pair of hands in trauma too. Now. I secured the chest tube, handed Erickson off to the surgical resident who just arrived, and ran next door. What I saw made my blood run cold. A man, probably in his 60s, in full military dress uniform, unconscious on the gurney with a massive piece of metal protruding from his chest. Blood everywhere. His vitals were crashing, BP 70/40 and dropping, heart rate through the roof, oxygen saturation in the toilet. The attending trauma surgeon, Dr. Walter Pearson, was already gowned up. He's got a penetrating chest wound, likely cardiac involvement. We need to crack his chest now or he's dead in 3 minutes. Who is he? I asked, pulling on gloves. A nurse I didn't recognize said quietly, that's General Franklin Benjamin. 4 stars. He's the Vice Chief of Staff of the Army. My heart stopped for a second, but my hands didn't. Training took over. Kate, I need you on airway and monitoring, Dr. Pearson said. We're doing this here. No time to get to an OR. This was an emergency department thoracotomy, one of the most intense, last-ditch procedures in all of medicine. You literally open someone's chest in the trauma bay to access their heart and major vessels when they're dying right in front of you. I intubated General Benjamin in under 30 seconds while Dr. Pearson prepped for the incision. Scalpel, he called. The incision was made. Retractors in. And then I saw it, his heart, right there, beating weakly, with a visible tear in the pericardium. He's got a hemopericardium, Dr. Pearson said. Probably cardiac tamponade. Kate, I need you to prepare for internal cardiac massage if we lose him. Let me explain something. Internal cardiac massage means if his heart stops, I'm going to put my hands directly on his heart and manually pump it to keep blood flowing to his brain. It's not something you ever want to do, but I'd trained for it. Dr. Pearson worked quickly, evacuating the blood from around the heart and identifying the source of bleeding, a small laceration on the right ventricle. I need to repair this, but his pressure's too unstable. Kate, start AP and push fluids. We need his pressure up before I can get a suture in there. I was already moving. Calling out medication orders, managing the 4 lines, watching the monitor like a hawk. His pressure wasn't responding. He's going into PA, I said, watching the monitor. Pulseless electrical activity, basically, his heart was showing electrical activity but wasn't actually pumping blood effectively. Start compressions, Dr. Pearson said. Internal. I didn't hesitate. I reached into his open chest and put my hands directly on General Franklin Benjamin's heart. And I started pumping. It's warm. That's the first thing that hits you. Human tissue is warm and slippery and shockingly delicate considering it's literally keeping someone alive. I could feel every chamber of his heart under my palms, and I squeezed rhythmically, manually forcing blood through his body while Dr. Pearson worked to repair the tear. Good compressions, Kate, he said. Keep going. 30 seconds. 1 minute. 2 minutes. My arms were burning. Sweat was dripping down my face. But I kept going. Almost there, Dr. Pearson muttered. Just need to, got it. Sutures in. Kate, ease off and let's see if he's got native rhythm. I slowly released pressure on his heart. For 3 agonizing seconds, nothing. Then, a beat. Weak, but there. Another. Another. We've got him, Dr. Pearson said. Sinus rhythm. Blood pressure's coming up. I stepped back, my hands covered in blood, my whole body shaking from adrenaline. Damn fine work, Kate, Dr. Pearson said quietly, already moving to close. You just saved a general's life. I didn't have time to process it. There were still patients pouring in. Quick pause. I know this is intense, and we're only halfway through. But let me ask you something, when was the last time you heard a story like this? About what healthcare workers actually do behind closed doors. These stories matter. They need to be told. And the only way I can keep telling them is if you subscribe and turn on notifications. I promise you, the payoff in this story is worth it. The moment with my sister? That's coming. But please, just take 1 second and hit that subscribe button. It genuinely makes a difference. Okay, back to what happened next. General Benjamin was transferred to the ICU after surgery. Dr. Pearson had successfully repaired the cardiac laceration, but he wasn't out of the woods yet. Post-operative cardiac trauma patients are incredibly fragile. By pure coincidence, or maybe fate, he ended up in my ICU. On my service. For the next 72 hours, I barely left his bedside. I managed every single aspect of his care. Ventilator settings. Vasopressor titrations. Monitoring for arrhythmias. Coordinating with cardiology. Managing his pain while keeping him sedated enough not to fight the vent but aware enough to maintain neurological function. His wife, an elegant woman in her early 60s named Bonnie, yes, same name as my grandmother, was there constantly. She'd sit by his bedside holding his hand, and she'd talk to me. You were there, she said on the second day. In the trauma bay. When they brought him in. Yes, ma'am. They told me you manually pumped his heart. I nodded. Dr. Pearson did the repair. I just kept him alive long enough for the repair to work. She looked at me with these intense, grateful eyes. You're very modest. I'm just doing my job. No, she said firmly. You're doing much more than that. On day 3, General Benjamin started waking up. I reduced his sedation gradually, watching for any signs of distress. When he finally opened his eyes, the first person he saw was me, checking his arterial line. Hey there, General, I said softly. Welcome back. You're in the ICU at Walter Reed. You were in an accident, but you're safe now. You're on a breathing tube, so you can't talk, but I need you to squeeze my hand if you understand me. He squeezed. Good. Your wife is right outside. I'm going to let her in to see you, okay? Another squeeze. I stepped out and got Mrs. Benjamin. The reunion was emotional, tears, gentle touches, her whispering things to him I couldn't hear. I gave them privacy and focused on my other patients. Over the next week, I oversaw his entire recovery. Weaned him off the ventilator. Transitioned his pain management. Got him stable enough to transfer out of the ICU to a step-down unit. On his last day in my unit, before the transfer, General Benjamin asked to speak with me. He was sitting up in bed, still weak but alert and oriented. His wife was there, along with what appeared to be several high-ranking military officials. Nurse practitioner Kate, he said, his voice still raspy from the intubation. I'm told I owe you my life. You owe your life to a lot of people, sir. It was a team effort. Dr. Pearson told me what you did. He said you performed the internal cardiac massage for over 2 minutes. He said your compressions were so good, so technically perfect, that you maintained enough perfusion to his brain that he's confident I won't have any neurological deficits. Is that true? I felt my face flush. I was trained for it, sir. I just did what needed to be done. He looked at his wife, then back at me. May I see your hand? Confused, I extended my hand. General Franklin Benjamin took my hand in both of his, and then, in front of everyone in that room, he lifted it to his lips and kissed it. You held my heart in your hands, he said, his voice breaking. You literally kept me alive. There are no words adequate to thank you for that gift. I felt tears welling up in my eyes. You're very welcome, sir. I'm just glad you're recovering. One of the officials stepped forward. The general would like to put you in for a civilian commendation. Your actions went above and beyond. That's not necessary. It absolutely is, General Benjamin interrupted. You represent the very best of what military medicine, what American healthcare, has to offer. And I want to make sure people know it. 3 weeks later, it was Christmas. Same family. Same dining room. Same cast of characters, including Tasha. I hadn't told anyone in my family about General Benjamin. It had been covered in the news, high-ranking general survives horrific crash thanks to Walter Reed team, but they didn't know I was directly involved. Dinner was going fine until Tasha, because apparently she's incapable of letting things go, decided to bring up Thanksgiving again. Kate, I want to apologize for what I said at Thanksgiving, she started, and I thought, oh, finally. I shouldn't have called you a glorified nurse in front of everyone. I started to say thank you. I should have waited until we were alone. My mother actually choked on her wine. Tasha. What? I'm being honest. Look, Kate, you do good work. You're very competent at what you do. But I think you'd be so much happier if you just accepted your role instead of constantly trying to prove you're more than a nurse. Charles threw his napkin on the table. Are you kidding me right now? I'm just saying, there's honor in being a nurse. You don't have to pretend you're a doctor. That's when my phone rang. I normally wouldn't answer during dinner, but the caller ID said Walter Reed Administration. I'm sorry, I need to take this, I said, stepping into the kitchen. Is this Kate? A professional voice asked. Yes? This is Howard from Hospital Administration. I apologize for calling during the holidays, but we have a situation. General Benjamin's office has been trying to reach you. He'd like to present your commendation personally, and he's asked if you could come to the Pentagon tomorrow at 1400 hours. I know it's short notice, but his team thought you'd want to know immediately. My heart started racing. The Pentagon? Yes. It's going to be a formal ceremony. Small, but there will be press. The general is very insistent that your actions be recognized. Are you available? Yes. Yes, I'll be there. Excellent. I'll send you the details via email. And Kate? Congratulations. What you did was extraordinary. I hung up and walked back to the table in a daze. Everyone was arguing. Tasha and Charles were going at it, Elena was defending me, my parents were trying to mediate, and Grandma Bonnie was just watching with an amused expression. I sat down. Everything okay? My mom asked. That was the hospital. I've been asked to go to the Pentagon tomorrow for a commendation ceremony. The table went silent. Tasha laughed. The Pentagon? What, did you give a general a band-aid? I looked at her. Really looked at her. And I decided I was done protecting her ego. Do you remember that massive accident 3 weeks ago? The military convoy on the highway? She shrugged. Vaguely. There was a 4-star general in that convoy. General Franklin Benjamin, Vice Chief of Staff of the Army. He had a piece of metal penetrating his chest, and he went into cardiac arrest in the trauma bay. I performed emergency internal cardiac massage, meaning I literally held his heart in my hands and manually pumped it for over 2 minutes while the surgeon repaired a tear in his ventricle. I kept him alive. And then I managed his critical care for a week in the ICU until he was stable enough to transfer. You could have heard a pin drop. The general himself asked to give me this commendation personally. Tomorrow. At the Pentagon. Because according to his doctors, my technically perfect compressions are the reason he has no brain damage and is going to make a full recovery. Tasha's face had gone completely white. So when you say I'm a glorified nurse who just follows orders and does grunt work, what you mean is you have absolutely no understanding of what I do, what I'm trained for, or what I'm capable of. And rather than admit that, you've decided to diminish my career to make yourself feel better about yours. Patrick was staring at his plate. Charles was grinning. Elena had her hand over her mouth. My parents looked shocked. And Grandma Bonnie was nodding with a satisfied smile. Tasha started. I'm not a doctor, I continued. You're right about that. But I'm not trying to be. I'm a critical care nurse practitioner with specialized training in trauma and acute care. I have skills that most doctors don't have. I've done procedures that most people will never do in their entire careers. And I'm damn good at what I do. So you can either respect that, or you can keep making snide comments, but either way, I'm done pretending it doesn't bother me. I stood up. I'm going home. Merry Christmas, everyone. Elena jumped up and hugged me. That was the most badass thing I've ever seen, she whispered. Charles hugged me too. I'm so proud of you, sis. My mom followed me to the door. Kate, honey, wait. Mom, I can't. I know. I just want to say, we're all so proud of you. What you did for that man, for his family, that's incredible. And I'm sorry Tasha has been so horrible. Thanks, Mom. Will you send pictures tomorrow? From the Pentagon? I smiled. Yeah. I will. The next day, I put on my nicest professional outfit and drove to the Pentagon. I was nervous as hell. I'd never been to the Pentagon. I'd never received any kind of official recognition. And I definitely had never met with military leadership in any official capacity. I was escorted through security and down what felt like miles of corridors until I reached a small ceremonial room. There were maybe 20 people there, some military officials, some civilians, a few people with cameras. And General Benjamin, standing tall in his dress uniform, looking remarkably good for someone who'd had open heart surgery 3 weeks ago. Mrs. Benjamin was there too. She smiled when she saw me and immediately came over. Kate, dear, you look beautiful. Thank you. How is he feeling? Stronger every day, thanks to you. The ceremony was brief but moving. General Benjamin gave a short speech about the accident, about the team at Walter Reed, and specifically about what I'd done. This young woman, he said, gesturing to me, held my heart in her hands. Not metaphorically. Literally. She performed a procedure that requires not just skill but extraordinary composure under pressure. She kept me alive when I was seconds from death. And then she managed every aspect of my care for a week, ensuring my recovery. He turned to me. Nurse practitioner Kate, on behalf of the United States Army and on behalf of my family, I want to present you with the Civilian Award for Humanitarian Service, for your exceptional dedication and life-saving actions. He pinned the medal to my jacket, and then he hugged me. Thank you, he whispered. For everything. The cameras were flashing. People were clapping. And I was trying really hard not to cry. After the ceremony, there was a small reception. I was talking with Mrs. Benjamin when one of the officials approached. Excuse me, Kate? We have some media who'd like to get a statement from you, if you're comfortable with that. Oh, I don't know if. You should do it, Mrs. Benjamin said. Let people know what nurse practitioners really do. So I did. I spoke with 3 different reporters, and I made sure to emphasize the team approach, the training that goes into critical care nursing, and the scope of practice that NPs have. One reporter asked, "Do you feel like the nursing profession gets enough recognition?" I thought about Tasha. About every person who'd ever dismissed what I do. I think there's a general lack of understanding about what advanced practice nurses do, I said carefully. We're not just following orders. We're diagnosing, treating, performing procedures, and managing complex cases. In situations like this accident, having highly trained nurses with critical care expertise can mean the difference between life and death. I hope that more people come to understand and appreciate the depth of training and skill that goes into this profession. The story went semi-viral. Not like massive viral, but enough that it was picked up by several news outlets. Nurse practitioner saves 4-star general's life with emergency heart massage. My phone was blowing up. Colleagues from work congratulating me. Old nursing school friends reaching out. My parents sent the article to literally everyone they knew. And Tasha. Tasha sent me a text on December 27th. It said, "I saw the news coverage. I don't know what to say. I'm sorry." I didn't respond right away. I sat with it for a day. Finally, I wrote back, "Thank you for apologizing. I hope you understand now that nursing, especially advanced practice nursing, is so much more than you thought it was. I don't need you to be impressed by what I do, but I do need you to respect it." She responded, "I do. I'm really sorry, Kate. I was jealous and insecure and I took it out on you. What you did was incredible. I'm proud to be your sister." I don't know if it was genuine or if she was just embarrassed by the public attention. Honestly, I don't care that much. Because I realized something through all of this. I don't need my sister's validation. I don't need anyone's validation. I know what I do. I know what I'm capable of. I know the lives I've touched and saved. And that's enough. General Benjamin is still recovering. He's back to limited duty now, and according to Mrs. Benjamin, who I talk to occasionally, he's doing wonderfully. They invited me to their home for dinner next month, which is surreal but really sweet. My relationship with Tasha is complicated. We're cordial now. She's definitely more careful about what she says. But there's still this tension, this history. That's okay. Not all family relationships are perfect, and I've made peace with that. What I haven't made peace with, and what I'll continue to fight for, is recognition for nurses and NPs everywhere who are doing this work every single day without recognition, without medals, without their families understanding what they actually do. We're not glorified anything. We're highly trained healthcare professionals who save lives, manage crises, and hold the healthcare system together. And if my sister, or anyone else, can't see that, that's their problem, not mine. So that's my story. From being called a glorified nurse at Thanksgiving to receiving a commendation at the Pentagon from a man whose life I saved. But here's what I want to leave you with. How many of you watching this have been underestimated? Dismissed? Told you weren't enough? Drop a comment and tell me your story. I read every single one. And look, I'm going to be real with you. I put hours into researching, writing, and producing these stories. These are real experiences from real healthcare workers, and they deserve to be heard. But YouTube only shows these videos to more people if you engage, if you like, comment, subscribe, and turn on notifications. I know everyone asks you to subscribe. I know it feels repetitive. But think about it this way, if this story made you feel something, if it changed how you think about nurses or healthcare workers or people who've been underestimated, then subscribing means you'll get more stories like this. Stories that matter. Stories that challenge assumptions. It takes 2 seconds. Just do it. Please. For every nurse who's been dismissed, every healthcare worker who's been called just a nurse, every person who's been underestimated, hit that subscribe button. Turn on notifications. And I promise, I'll keep bringing you stories that are worth your time. Thanks for watching. I'll see you in the next one.